But I just wonder, what self-care strategies do you recommend for parents who have a child who has a learning difference or is on the spectrum, just a child that is struggling, period?
It is exhausting. It's exhausting both seeing your child in pain and you are trying your best. And the system, unfortunately, some areas, may not be as sportive, in terms of getting a psychological testing, long wait list, going through all the 504 meetings, IEP meetings. Getting through all those things is exhausting, it's time consuming, and it's frustrating. I think in those times, I will highly encourage to bring the power of collaboration. So collaborate, reach out to other parents, who reach out to regional organization, who may be working on those areas. Especially after COVID, I know there are so much social media avenue, parenting groups on Facebook, on different, I think if reach out, just share, I am going through how I can help. Having a parenting advocate is a lot of, I'm so much surprised that a lot of time parents don't even know. They are just trying to fight on their own, but having a parenting advocate that can help you, guide you, what language you want to use when you are having those 504 meeting, IEP meeting, how you can advocate better for your child. The third thing is, sharing your vulnerability with your child as well, so you can both heal together. That I know you are struggling and I am also struggling to help. I am trying all those things. Is there anything, do you know any other kids who may have similarly? Then, you can reach out to their parents. And always, reminding yourself that, yes, this is one part of my child, but he, she, or they have so many strengths. And reminding yourself, yes, you are struggling helping your child in this area, but you have helped them grow in so many different areas. You have helped them excel in so many different, avenues. So reminding all those strengths, having gratitude, having faith, in you, in God, that if the God has given us, this blessing in terms of our children who have strength and the vulnerabilities, the God also has given us courage. Sometimes it may take a longer time, but I think as long as we are more hopeful and keep reaching out to, the people, who may have more expertise, like a advocate, reach out to other parents, and also, bring your family, your spouse, your other, siblings who you can trust. So the more power you can bring to it, the more hands you can bring to it. You may not have to do it alone.
Yeah, for sure. And I really appreciate that reminder, because you're right. This is just a part of our children, and there's so many other different parts. And I think it does boil down to just finding that balance as a parent, to take care of ourselves, because as you've said before, I mean, we can't take care of our other, our children and all these other things if we're not taking care of ourselves. And I love that you say collaborate with other parents, share how you're feeling. That in itself, I have to tell you, is courageous. I mean, for me, it took me a long time to really talk about my child and his being on the spectrum, but there's a level of courage that comes from sharing your story, because then other people say, oh, my daughter is also struggling with this and this, or oh, my granddaughter has this. And so then all of a sudden you realize that you really aren't alone. And I think sometimes as a parent, that's where the most trouble lies, is that you feel, this is so frustrating, this is so hard, why can't this just be easier? And you feel alone in that.
I agree. Yeah.
So I really appreciate you sharing that so much.